Hey everyone, welcome to my YouTube. I'm Dr. Sanam Dillon, specialist doctor and skincare founder of Rock Melon Skincare for melanin-rich skin. Today's topic is a bit different. It is my personal experience with a surgery that is quite a hot topic. I think 3 million people have had it. It is called an ICL surgery or an intraocular lens, a phakic intraocular lens. So these are just medical implants for correcting focus error. I had short-sighted vision. I could literally only see things this close to my eyes, and I wanted these for long distance viewing. I have been a contact lens and glasses wearer since I was 12 years old, so this is a long time coming, and I'm here to review honest review about the ICL surgery, the experience, and I'm now about 6 to 7 weeks post-operative, and I can give you a really honest opinion about how it's all going. So keep watching if this is interesting. So a phakic intraocular lens, there's two main types that are implanted in the world as we know it. The ICL, or the implantable Collamer lens, and the Artiflex lens, which are the only two available in Australia at the moment. The other forms of surgery that you can have to kind of improve myopia or nearsightedness is a really common surgery called LASIK, or laser vision correction surgery. Laser vision correction versus phakic intraocular lenses. Why I couldn't have this and why I often don't love this procedure, why I chose an ICL over an Artiflex. I'm also going to go through that today. So laser vision correction is where they actually shave off the top layers of your cornea to be able to reflect light in a different way so that it hits the back of your eye and allows you to have better vision. This is an irreversible surgery. They literally remove the top layer of your cornea, which cannot regenerate on its own, and it is generally quite a painful procedure. You're awake. It is also something that causes severe dry eye, something that I really struggle with. So laser vision correction is done when you're awake. You get really bad dry eye. You still don't really have great UV protection of your eye with laser vision surgery, and you generally have to have very, very stable vision for that, and generally need a lower power than mine. Mine was negative 6.5 pretty much in both eyes. So I opted for the phakic intraocular lens because it's reversible. My vision is not very stable, but it is stable enough. I had 6 to 12 months of stable vision to have this done. So if my vision actually gets worse over time, I'm able to get the lens exchanged. It's not ideal because it's very expensive and every eye surgery has its risks, but I liked this approach because apparently the quality of vision is better. I can't speak for laser because I haven't had it done. I've had ICL done. The dry eye symptoms are not present. It doesn't increase your risk of retinal detachment, which is a condition where the back of the eye, the retina, actually just detaches off and you can go blind. It provides UV protection to the back of my eye, and it is also able to treat very high focus errors, which was me because I am super blind. The surgery also doesn't change the natural shape of your cornea, and having a phakic IOL doesn't reduce then your ability to get premium cataract eye surgery later in life. So these were all the kind of pluses, the benefits of having phakic intraocular lenses. Then I was left with the choice of getting an ICL surgery or an Artiflex surgery because it was a no-brainer. I think I wanted intraocular phakic lenses because it just seemed like the best option. It ticked all of those boxes I just talked about. So Artiflex lens is a silicon-based and PMMA plastic lens. It sits in the front of your iris, so you can actually see it. So you've got your cornea, and then you've got the Artiflex lens that sits there, and then you've got the colored part of your lens. And the Artiflex lens is like this. It's like almost like a half version of a contact lens that's squished up with two claws on either side, And because I've got quite light eyes and I do quite a lot of photos and images and stuff, you can actually see it. The benefits are that the vision apparently is more crisp than having ICL surgery. The other benefit is that you don't get halos around lights, which is a common issue or known in the ICL surgery. And the recovery is a little bit quicker because it's not as invasive. In general, Artiflex, you get better night vision, you get better quality vision, but it's not very well studied. It's unproven, but it's likely because of the halo effect. There's no glares around light. Nighttime driving is better. The option to correct astigmatism, which is more accurate than ICL, apparently. Again, unproven but likely. And there's a lower likelihood of requiring surgical revisions or adjustments because the ICL does require the right measurements to sit behind the iris and between your lens, your natural lens of your eye. And the risk of glaucoma is slightly lower as well. The advantages of the ICL were that you couldn't see it because it sits behind the colored part of your eye, so you can't actually see my implants. Occasionally when the light hits from a tangent into my eye, you can actually see a little cloudy thing right behind my pupil, but if my pupils are really tiny, you can't see that. It's easier to implant because most surgeons offer it, and it has a lower risk of corneal endothelial cell loss. Because the Artiflex sits right next to the cornea, there's a theoretical risk that it can, over time, cause endothelial cells in your cornea to just degrade over time. And it's also less expensive than an Artiflex surgery. The main reason I opted for an ICL was that cosmetic. That was the main reason. And it was not about the cost for me. I didn't find that $1,000 to $2,000 difference was that ridiculous, but it was more the fact that you could see the Artiflex. And I just didn't want to take that risk, have it done, and then really regret my decision. So if you do want to know who my surgeon was, I have full rights to tell you. He is Nick Andrews at the Sight Specialist. He does both, and he's the only one in Australia that does Artiflex, and he's one of few that do ICL surgeries as well. It was incredible because I was going for a family member's appointment for unrelated topic of diabetic retinopathy, and I was like, oh, I really want to get laser vision correction, and he said, why would you do that? Wouldn't you just get a reversible procedure? I was like, I didn't even know that existed. So he really opened up my eyes, and his level of accuracy and detail and precision and meticulousness was what made me want to go with him. So I only ended up seeing one surgeon, but I had an optometrist that told me he was excellent, and I had seen him work on a different patient. That was all I needed for my decision making. But if you were to, want a surgeon, I would definitely get 2 consults just to make sure that you're happy with the surgeon that you choose. And his communication is excellent. He's the best. Go check him out. If you're on the Gold Coast, go check him out. If you're in Brisbane, he's just an hour drive away. And honestly, I would fly to see him. And I had to go to Singapore a week after my surgery, and I had my post-op appointment, and there wasn't any issue, so I could fly post-surgery. So yeah, you can fly to see him if you really wanted to. So next stage is, how was the procedure? So the procedure was done under general anesthetic, so I was put to sleep for it. I had to wait 6 months because I needed to make sure that my vision was stable, and then I had my procedure done, and they had to order in the lenses from, I believe, the US, but they were manufactured in Switzerland, or I've got that wrong way around. But I had to wait for the custom sizes to be ordered, and then I had my procedure done. So obviously you have to fast for your procedure, don't take blood thinners, blah, 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 can't take fish oil, etc., etc. There's a strict pre-operative guide and post-operative guide of what you can and can't do. I couldn't rub my eyes for 24 hours after. I couldn't swim for 2 weeks. I had to sleep upright without touching my eyes for 1 to 2 weeks. The first 2 nights were probably the most painful, but even then it was pretty incredible, and I had to wear eye shields. I woke up with stabbing eye pain, but apparently that was just the antiseptic, and that went away within like 30 minutes when we put some extra pain numbing drops in. So it was quite shocking to wake up in that much pain, but it was for 30 minutes of pain and 7 weeks of amazing vision, I would take it. The recovery process was fairly easy. I had my hubby to help me. Obviously, you can't do things like cooking and cleaning, and you don't want to get your eyes wet. So I didn't wash my hair, and the eye drops burn. Like, they're up to 4 weeks that you have to use them for. There's 3 main eye drops. For week 1 to 2, there's an antibacterial eye drop, so chloramphenicol. And then the second eye drop that we had to use was an anti-inflammatory, which was a non-steroidal anti-inflammatory NSAID drop. And the third was Predfort, which is like a combination of a steroid and adrenaline eye drop, which then needed to be continued for 4 weeks. I'm actually still on that eye drop, but I stopped it and restarted it just to clear up some pigmentation on the ICL, which I don't even notice. So overall, the post-operative stuff was pretty easy. I had 1 appointment a day after, an appointment a week later, and then another appointment 6 weeks later, which was, or a month later, 6 weeks or a month, which was awesome. The fact that I could see 20/20 vision without needing to fumble around for glasses, without needing to be blind, run into things, go to the toilet, like, it's just amazing to wake up with vision. And you woke up with vision when you woke up from the procedure, which is it's just amazing. So the expectation is that your vision won't be as good as when you wear contact lenses. It's only as good as when you wear glasses and have bad vision. The quality of vision that's achieved is often downplayed because most people might have a different reaction. So the goal of the surgery isn't to get you to contact lens wearing vision, but glasses wearing vision. And the reason for that is your cornea, when you wear a contact lens and you put it over your cornea, it takes away all the little bumps and lumps and makes light come in equally. So when you wear a contact lens, you're going to have the best, most amazing crisp vision. And for someone who is very particular, very OCD, very needs everything to be crisp, I thought I would struggle with not wearing contact lenses. And the only time I would say that I really struggle is at night. My nighttime vision is not as good because what happens at night is your pupils go from being small to really big. And when they're really big, there's more irregular surfaces of the cornea to take in. Because of that, the pupil dilation is not as good. So that's the first thing, the cons of the procedure. The second con is the glares and the halos. Personally, I don't find them difficult at all. My version of the halos, everyone's different, is like this tiny little ring of light that just dances around. And the first time I saw it was really cool. And now I don't ever notice it. Like, now I know that I'm looking for them and I can see it, because when that light hits the side of my eye, I can see the little halo. But they're like really big and they're not a problem for me at all. They're like negligible. That's my experience with halos. My reading vision is great. The risk of early cataract formation now, because the Artiflex, the ICL lenses are different. So they are, I'll insert a photo, but so they're like this. So there's a little hole in the middle, where your pupil will sit over the top of this. And this is what the actual lens looks like. There's 2 holes on the side, and this reduces the risk of pressure buildup, and this reduces the risk of cataracts and rubbing in certain ways. So there's in a high magnification behind the pupil, you can see that central hole, but you don't see it to the naked eye. You can't visualize it. I can only see it because in emergency, in my shifts, we've got a slit lamp, so I like to get hubby to have a look into my eye and see how everything's going. So it's positioned behind your pupil and in front of your lens. And it's a pretty snug fit, so the measurements have to be perfect. That is the second risk. So I was freaked out about the vision's not good as your contact lenses. I freaked out about the night vision. I freaked out about the halos when I was doing my research. And lastly, I freaked out about the fact that I potentially might need to have a second surgery. So because Nick my ophthalmologist was so particular. I didn't need to have a second surgery, but there's a chance if your measurements are off by like a millimeter, you might need to go in for another surgery where you obviously have costs involved and they need to just put in a different shape or size ICL instead. And there's a very, very tiny chance that that might happen. So that was a bit of a concern. But luckily I didn't have to go through that, and other patients might have to. As of 2025, like over 3 million people have done ICL surgeries, and there's a crazy statistic that I think over 98% of patients would highly recommend it to someone else. And I think that with the fact that there's so much like concern about halos, there's so much concern about reading, there's so much concern about, you know, retinal detachment and significant risks, I think that it is important to understand that it is a reversible surgery, and that if you've got a really good ophthalmologist, if you've picked the right person, I think it's a no-brainer. I would 100% recommend it to someone else. Obviously, this is not medical advice. That's just me being Sanam and recommending something that I've had that might, you know, really benefit someone else. And also being a medical professional, doing surgeries, minor skin surgeries, doing really like high attention to detail tasks, looking at other people's eyes in the emergency department under slit lamps, taking out tiny, tiny foreign bodies. Has it affected my work? No. The first 2 weeks when I went back, it was a little bit blurry, but my day-to-day life is definitely, my quality of life has 100% improved. And I can even wear glasses or contact lenses over the top if I'm really bothered by the nighttime vision not being good, which was awesome. It's like I can still wear colored contacts if I want. I can still do things and not get severe dry eye. This video is by no way sponsored by anyone. I paid for my surgery. By the way, I think it was just in terms of costs in Australia, the surgery cost was around about 10 to 12,000 for the ICL and 12 to 14,000 for Artiflex. I don't know what laser vision correction surgery costs, but that's full transparency. What I had to pay, that included all my, you know, surgical fees, my assistant fees, didn't include anesthetic fees. I think that was an additional 400 or 500. But I mean, I'm 31 years old. I was blind. I was worried that if I had a kid, I would accidentally sleep on them and not realize that they were there. So for me to have vision it's just, I'd definitely work hard and pay that off. And the fact that it's reversible, and the fact that, you know, when I go in to get my cataract done when I'm older, they just take everything out, pop in a new lens, and I'm good to go. So yeah, my personal opinion is that I've had a great experience and I would recommend it. Common risks we should talk about. I mean, every procedure has risks. So there's obviously the risk of bleeding, infection, trauma, needing to go back in for surgery, pain after surgery because of the antiseptic, which I did experience. Inflammation and sensitivity to light is a definite common risk. You can get a subconjunctival hemorrhage. Here's a photo of it. It looks nasty. It looks nasty, but it isn't. It doesn't threaten your vision. It happens in about 10% of cases, which is high. So you don't want to be organised a party or a function or attending one if you do get that. But luckily I didn't. You do get small little, where the incisions are, you do get 2 little like red bruises, which is fine. Uncommon risks are glaucoma or unstable eye pressures, and so usually they fluctuate and they can use drops to help with that, and medications and interventions are rarely needed but generally quite good. There can be prolonged healing time, so obviously it just depends on your personal risks. There can be unexpected defocuses post-operatively when your eye is healing and your cornea is irritable. That can happen. And halos and glares around lights. So the halo is like at daytime and nighttime. When you're looking directly at a light, or when the light's shining into your eye from the side, that's when the halo forms. And apparently it subsides within 3 months, but it doesn't disappear completely. And some people's brain interprets a halo as a very large halo. Some people's brain interprets it really tiny. That halo is because of that little ring that I showed you in the middle of the ICL, and having that small hole is really, really important because it reduces the risk of cataract formation, but it also does increase the risk of persistent halos and glare symptoms. So if nighttime driving is really, really, really important, it's a fundamental that you can drive very well at night and don't want halos and sensitivities to glare, then you do need to choose the Artiflex, I would say. But if you have a very, very large pupil, the Artiflex also has some issues, but your ophthalmologist can explain that to you. Just make sure you ask. Now, really, really rare risks are that, one, you need to go back to theatre, two, that you get a really, really bad infection. I think the risk I was quoted was less than 1 in 20,000 for all of these. Infection of the cornea, which can cause blindness, and corneal endothelial cell loss, which is lower for ICL compared to Artiflex, as I mentioned. Bleeding, cataract formation can theoretically be earlier, but that risk is reduced, and there are surgical steps that are done to reduce that, apparently. I don't know what they are. So the Artiflex doesn't accelerate that risk, but ICL may. But there's no proven data for that yet. You can get ptosis, which is a drooping eyelid, and that is usually less than 1% of cases, usually improves over time, and can be lifted surgically if it's permanent. But again, less than 1 in 20,000. Sometimes whenever you have an eye surgery, you can get something called sympathetic ophthalmia, where when you surgically work on one eye, and I had a patient that had this, they had a cataract done in one eye and the other eye got inflamed, and it's 1 in 10,000 case. But that inflammation for my patient caused quite serious complications. So it is something to still be aware of. And, you know, if there's any issues, talk to your surgeon about that. So that wraps up my chat about my personal experience, unsponsored, honest review of how my ICL eye surgery went. And this is a photo of me wearing my little glasses before. This is me after with my eye shields, and this is me now. Hope you enjoyed our video, and make sure you go check out all my other videos about brown skin. I feel like a lot of brown skin people wear, skin of color people wear glasses, so that's why I did this video, so hopefully it'd benefit someone. All right, bye.